Thank you, Ciarán Comhairle, and thank you, Minister. My topical issue in particular is focused on the general issues and the lack of services for child mental health services across the country. For example, our primary care psychology appointments. Throughout the country now, there is over 6,500 children waiting for a primary care psychology appointment up to the end of May 2018. Some 1,700 of those waiting for over a year to be seen. And our child and adolescent mental health services are increasing. Almost 3,000 children are now waiting for a first appointment, over 300 of those waiting for over a year for a first assessment. This is an intolerable wait for children to see a specialist in terms of their mental health services, their sister, if you like, services, the psychology services and the child and adolescent mental health services, which is our acute mental health services. And delays in one, no doubt, in community psychology services is leading to an increased pressure on our child and adolescent mental health services, the acute services. But unfortunately it gets worse. The number of children that are being admitted to adult units is increasing by 20%, so it has in the last year. This is where children who should not be in there, it is against government policy, are being admitted to inappropriate settings. But unfortunately, doctors and families are left with a Hobson's choice. Either get the services in an inappropriate setting or not get the services. And again, that is totally inappropriate. There is no multidisciplinary teams effectively out there to be able to support parents and children when they need help. And I look at my own county, for example, where there should be 3 consultant child psychiatrists. There are none. There are only 2 approved, but there are none for an entire county of 150,000 people. In child psychology services in my own county of Wexford, there are a 34-month waiting list and will not see any urgent cases. And the Minister promised last October a new site for inappropriate facilities that specialists are working out at the moment. Then it was promised for this summer. Now it's December, and what I've been told locally is the building is actually out for rent at the moment.
Minister, more than 700 children with mental health difficulties are on a waiting list for specialist treatment service in the Cork and Kerry region. This is including 200 waiting more than a year. Delays in accessing child and adolescent mental health services worsened recently in Cork North Lee, which closed to new referrals last month following the departure of a consultant psychiatrist. The HSE said referral rates among under-18s in the Cork-Kerry area have risen by 26% since 2011, including a 10% increase in January to June of this year versus the same period in 2017. As of March this year, there were over 2,691 children and young adults waiting for the HSE to provide them with an appointment. That's just an appointment. The HSE Mental Health Services disclosed that of the 2,691 children and young adults awaiting CAMHS appointments, 1,369 of these were waiting for up to 3 months, 470 up to 6 months, 241 up to 9 months, 225 up to 12 months, a staggering 178 up to 15 months, and 80 up to and over 18 months. It goes on and on and on. We all know that CAMHS staffing is only at 56%, and not to be disrespectful, because we're probably going to get a lot of generic answers on this. We're well aware of it. Cork is totally understaffed, Kerry is understaffed, Wexford is understaffed, Tipperary is understaffed. We now have problems in Waterford, we now have problems in Sligo. And the most unfortunate thing about it is, and I'll give you how bad it actually is within 16 seconds. A 13-year-old who was in CAMHS, but somebody in their wisdom decided that she may or may not have Asperger's, was discharged from CAMHS, but needed an assessment. That assessment still hasn't come, and that child is doing her leaving cert this year.
Thank you, Deputy Minister.
Thanks again, Ciarán Comhairle, and just to thank both Deputies Browne and Buckley for this topical issue, and again on behalf of Minister Daly to apologise that he can't be here. One of the government priorities is to ensure appropriate and accessible mental health services for children and their needs. This is reflected by the Budget 2018 allocation of additional £35 million for the new development, bringing the total HSE mental health funding this year to over £910 million. The HSE Service Plan 2018 commits to further development of child and adolescent mental health services against the background when the population of children is expected to increase and where the demands for CAMHS has been seen a significant increase in recent years. Around 18,800 referrals are expected from the HSE CAMs this year, with about 14,300 have been seen by these specialist services. Additional resources and facilities means that there are now 69 CAMS teams and three practitioners liaison teams supported by 68 operational CAM beds nationally, with further beds planned to come on stream in the near future. Paediatric, as you said. Since 2012, over 1,300 health professionals have been recruited across the mental health service to modernise and improve services. However, there are widely acknowledged difficulties in recruiting and retaining specialised CAM staff, particularly consultant psychiatrists. The HSE acknowledges that the lack of consultant cover can impact on the access to services locally. It is working to explore avenues for the recruitment of qualified staff to fill vacancies, particularly in the areas such as consultant psychologists and nursing posts. The HSE is working to provide the best possible CAM service within available staff and resources. A key approach to developing the wide services for young people and thereby reducing pressures on CAMs is the decision by government to increase access to counselling services in primary care, with the appointment of 114 assistant psychologists and 20 psychologists nationally. In addition, Minister Daly recently approved 10 new posts for advanced nursing practitioners that are being specially directed to the CAM services. Other CAM-specific measures included in the HSE service plan include increase of a number of CAMs of referrals to be seen this year by 27% compared to 2017, provide for 7-day per week services for CAMs to ensure support for young people in line with the Connecting for Life, to improve CAMs daily hospital services, develop an eating disorder specialist community teams for young people. Minister Daly has set a priority with the HSE the development of a 24-hour helpline and digital support services. There will be enhanced access to support, and their appropriate facilities facilitate early and urgent interventions using in initiative digital technology. Cork and Kerry Community Healthcare has around 168,000 young people under the age of 18, in line with the national average of 25% of the population. The CAMS enhancement project commenced in September 2017, given local and national concerns about the growing demands for CAMS services in the area. As a priority, the initial focus has been on reducing waiting times in excess of 12 months in Cork and Kerry. However, in the longer term, the project aspires to addressing both systems and culture practice, changing and improving access to CAMs. And I'll come back on some of the other things.
Minister Deputy Browne, yes.
Thank you, Minister. Minister, you mentioned the number of CAMS teams, but the vast majority of these are understaffed. You talk about the difficulty in getting psychiatrists, but the College of Psychiatry this year sought an increase from the HSE of a 10% increase in the number of training places. The HSE would only approve 5%. The government refuses to extend the National Treatment Purchase Fund to mental health services. The government refuses to appoint a Digital Safety Commissioner, which is critical to addressing the concerns that young people are experiencing online. Due to infighting between departments, Pathfinder, a crucial programme set up by this government, is not being financed so it can implement necessary supports for young people. Dr. Kieran Moore from Wexford, consultant psychiatrist, left Wexford because Slaney House is not fit for purpose. He left after being there for 13 years. We were promised that the building was going to be a new building. Last October was promised, and it's still being promised, and it's still not being delivered. Children are distraught, parents are distraught, and it is simply not acceptable. Not enough has been done.
Buckley.
The answer. I'm not surprised it's more of a generic one and everything. I am kind of happy actually that Cork was actually mentioned in the answer when you ask a question in this House, because normally you ask about a pen, you don't get pen in the answer. It doesn't give any solutions. It mentions 168,000 young people under the age of 18 waiting for this, waiting for that. There seems to be no plan. The plan was to reduce the waiting times from under 12 months. There's 631 people waiting over 12 months in Cork at the moment for this. You mentioned the CAMS teams, 69 CAM teams, 4 of those I think in the country are staffed. We won't be having a Premier League of 60 or 70 teams because we can't set up a Premier League because we don't have fully staffed teams. It's absolutely disgraceful. Difficulty in recruiting, pay the staff, you might get them. The generic answer is desperate. But I'll tell you in the very brief time, I will be very brief, how realistic and what's happening here, and I want you to get to grip on this. At present, and I got permission from the mother just before I came in here, a 15-year-old person who has been bullied and bullied, has been moved from school to school, who has struggled to stay in St Michael's in Cork, attempted suicide, has cut all her hair out, her father's stage 4 cancer, and we're being pushed from pillar to post. And you're telling us that there's a big push on in Cork, there's a big push on Kerry. You heard Deputy Browne say it a while ago, Wexford is falling apart, Tipperary, the whole lot. You know what? It's time that this government, I'm fed up of coming up inside here and talking. It's verbal diarrhoea. These are people that are actually struggling. You go down and see that family and see the hurt in that mother's face. Don't be coming in here with generic answers, because I tell you, it's an absolute insult to the people that we're supposed to be representing in this House.
Thank you, Deputy Minister. To conclude on this matter, please.
Well, thank you, Deputy, and I do hear your frustration. And I do hear your concerns. I know it's not, and I'm not taking it as a personal attack. However, I have read the reply I've been given, and unfortunately I can't specifically answer some of the questions that have been asked by yourself and Deputy Browne, but I have taken note of them. And as always, when I'm asked to come down here, I always directly go back to the Minister, who I have been asked to step in their place, and I will raise the concerns. However, in reading the reply, it's clear to me that there is a huge shortage, and particularly in recruiting through the CAM services. And maybe some of the reasons are, maybe that, as you have said yourself, around finance, but I think some of the reasons are as well, which I've experienced myself as a local TD, is it's a very difficult place to be in children's psychology, and people do get burnt out very quickly. And unfortunately, some people decide to move on for whatever reason, and I can understand those reasons. However, Ceann Comhairle, the reply I was given to read out isn't significantly adequate enough to reply to some of the questions that's been asked, but I will go back to the Minister for the both of the questions I've been asked to cover, and will ask him to reply directly to the deputies who have raised the issues. Okay. Minister.